Hello, everyone. My name is Mallory Doolin. I am a registered dietitian, and today I'm going to discuss the trans-theoretical model of change and motivational interviewing and how the two complement each other and help provide a really great environment and method to provide great quality nutrition counseling to our clients. So we'll get started with a little background on the trans-theoretical model. So the trans-theoretical model is also known as the stages of change, and this is a model that recognizes behavior change as a process that happens over time. This process is gauged by 5 levels of readiness to take action. And then that gives us an understanding for why our clients may change. So we look at those different stage levels of readiness and those different stages of change, and then we can understand where our client is and why they may change and what are the best strategies. So the 5 stages of change include pre-contemplation, contemplation, preparation, action, and maintenance. So to review the stages, pre-contemplation is when our client has no intention of changing within the next 6 months. In contemplation, our client is aware of the issues and understands the need for change in behavior. They're considering change sometime within the next 6 months. In the preparation phase, the intentions to change are there. They're within the next 30 days. So they're ready to make those changes, and they may be demonstrating some small changes already. In that action phase, the person is fully engaged in the stated behavior change. And lastly, in the maintenance stage, this person is fully engaged in the behavior change for at least 6 months. So the 5 stages of change are often shown in a circular diagram like this because our patients and clients work through the stages, and they can be at any stage. They can skip some stages, they can go back in some stages. So it's all about where they currently are with the stated behavior. So the trans-theoretical model is really especially useful for us as practitioners because it provides specific strategies to motivate change with our clients, considering their current stage of change. Patients may fluctuate between the stages of change throughout the process. This is normal. And when we're talking about how motivational interview really complements this, it's a skill to help patients resolve their ambivalence. So the ambivalence is very common in those pre-contemplation, contemplation, and preparation stages. So this is when motivational interview comes into play, when they're in one of those 3 stages I just mentioned. Because again, it's a person-centered counseling approach, and it is best for addressing ambivalence about change. So it would actually not be very useful to use motivational interviewing when the client is in the action or maintenance stages because they're already participating in that behavior. So there's no need to elicit that change talk or motivate their change, work through that ambivalence because they're engaged. So again, it's really important when we're talking about those earlier stages, pre-contemplation, contemplation, and preparation. So when we've identified that a patient or client is in one of those 3 stages of change that would benefit from motivational interviewing, we can use those motivational interviewing skills to help resolve ambivalence. So OARS is an acronym used for some of the 4 main skills used during motivational interviewing. So open-ended questions are a way a counselor can collect details. So that's simply avoiding simple yes or no questions and answers. So it it gives that client the way to be a main contributor to the conversation, lets them be the main person talking in the conversation, and definitely helps get that baseline information. As you're asking those open-ended questions, you can use some of these other skills, such as affirmations, which show acceptance or recognize a client's efforts. It's a way to tell them a job well done. They're in definitely a hard place. So helping them, feel better about their situation can really help increase their self-efficacy and help promote that change. Reflective listening. So this is really where we're going to identify that change talk. We're going to elicit that change talk from our clients. So this is when a patient may make a statement and identify change talk. So this is an opportunity for counselors to really select pieces of the conversation to reinforce by mirroring or repeating back some of the words the patient or client has said of their own statements, and helps them hear what their own purpose and reasons for changing. Lastly, another skill that's helpful is summaries. So this helps focus on what has been said throughout the counseling session. It's a way to really sum up and give that bigger picture to our clients. And it can exemplify ambivalence and discrepancies from the conversation. So these 4 skills really help resolve that ambivalence because we're really working through what the resistance to change is. The counselor is able to identify areas that the patient may need to continue to work through, or maybe help them identify that they have resolved and they do know what they want to do moving forward. So to summarize, really, motivational interviewing is a complex skill and communication method that enhances motivation to change. We use those oars, we use those skills, we have the conversation, and it helps move our client into that motivation to change. Motivational interviewing skills help their clients voice their concerns, give reasons to change, give intentions to change. So really, when it's all said and done, this all together helps to resolve ambivalence and promote change. So ultimately, motivational interviewing is very helpful when we are using that stages of change model, because when we're working with those specific strategies and we're working with those patients that are contemplating change, we're able to help them resolve their ambivalence and work together to create an opportunity for a lasting change. Thank you very much.